Allergies, it can range from mild to severe.
For many parents, giving their kids a daily medicine that could actually prevent an attack could be life-changing for them and their kids. Now there's a new drug that's showing promise, not just yet ready for consumers just yet, but we wanted to talk more about it with our medical expert, Dr. Mandira Mehra from SSM Health. Good morning.
Good morning.
So we actually have Elizabeth here, who's a student at Blessed Sacrament,
Yes.
who's talking about their kids in her school who have nut allergies. It seems you can't go to any school these days where kids don't have peanut allergies.
Yeah.
This idea of trying to be able to stop an attack before it ever happens is significant.
It's significant, and it gives so many parents, teachers, friends, family members really relief to know that there might be hope sort of on the horizon. And so this was a really interesting study that showed perhaps if we desensitize children, so it looked at kids very, very young, all the way up to age 17, by exposing them to really the protein in peanuts or the oil in peanuts, that kind of thing, at higher and higher levels, perhaps we can prevent whether it's a mild or really, really severe allergy to peanuts.
Is this going back to, I mean, I remember when we were kids, isn't that what our parents did, is they introduced us to this at an early age?
And so the pendulum has really swung. Initially it was, don't expose your kids to peanuts because it could cause this deathly allergy and you don't want to risk really a child's life. The pendulum has completely swung the other way. The allergy immunology groups in America have recommended actually earlier exposure. And so this does go hand in hand with that early study that we talked about probably last year, that really exposing kids as young as 6 months of age to peanuts prevents allergies down the road. And now they're even saying perhaps in utero, if the mom were to eat peanuts or nuts or something, that may even help prevent allergies. So the pendulum has swung the other way from don't expose the kids to peanuts to actually exposing them to peanuts may desensitize them and prevent deathly allergies like anaphylaxis.
Now going from a very young population to our elderly folks, and there's a study that came out too that we wanted to talk to you about excessive alcohol use and how it contributes or could contribute to higher dementia rates. What's your takeaway from this? And kind of, we talk a lot about everything in moderation with you. So
I feel like sometimes I say kind of contrary things. Sometimes I say have a glass of alcohol, don't have a glass of alcohol. It's good for cancer, it's bad for cancer, bad for the brain. What do we make of this? So really the important takeaways here are excessive alcohol or alcohol abuse. So we're not talking that glass of wine, once or twice a week. We're not talking about that beer that you might have at happy hour. We're talking about alcohol abuse here. This was the largest study of its kind. It looked at over 1 million patients and a French population, and they looked at the dementia rates and then connected that with the alcohol rates. And so early onset dementia was connected to over 50% of people that also had alcohol abuse problems. We've known for many, many years that alcohol and dementia go hand in hand for many reasons. The byproduct of alcohol is toxic to the brain. It also causes vascular issues, diabetes, all those things that we always talk about, as well as hepatic encephalopathy. So we know that it's injurious to the brain. I mean, some of those sort of lighter effects is why many of us like alcohol. However, at that excessive level, it increases that dementia rate. It increases that rate of early onset cognitive disabilities.
And even more so amongst men.
More so amongst men than women. And this goes into the question of why. Scientists, doctors have racked their heads around, do men just live unhealthier lives? Is it associated with more tobacco, more unhealthy sort of things that they're doing, or depression, things like that? That's sort of a mystery and a question. Why is that higher in men?
To be continued for sure, especially as this issue gets more and more prevalent in our society. Dr. Mehra, thank you so much. It's
nice
good to see
you
you
guys.
Thank you.
6:20 your time right